Hi everyone, I am here with Sonja Armbruster, and we will be having our interview for National Public Health Thank You Day. Hi Sonja, how are you?
Hi, I'm good. How are you?
I'm doing pretty well. So to start off the interview, one of the first questions I wanted to ask is, what drew you to a career in public health?
So my entry into public health was entirely accidental. I was in class, and we had a visiting professor come and talk because he wanted to recruit people to help him with a research project. And I said, sure, I could go work at KU for almost minimum wage for a summer, and that turned into a career. And I didn't know that that was what I was doing at the time, but Dr. Doran Fredrickson was the reason I got into public health and got me started.
That's awesome. It's funny how things can kind of just happen by accident.
Exactly.
Nice. The next question I have for you is, what types of projects have you coordinated / helped with this past year?
So I would say that to get any real public health work done, a whole lot of people have to be involved. But some of the things that I've been most excited about that I've had a hand in include supporting a community health worker coalition. So we've had 2 summits statewide to begin to develop the community health worker coalition and the community health worker workforce in our state. And I'm excited about the prospect of where that's headed. I'm really proud of the work that the Community Engagement Institute and the Center for Public Health Initiatives and the Center for Leadership Development has done to collaborate to provide leadership training to local public health workers. And that's been a lot of fun and is meaningful. And also I've worked with a statewide coalition on chronic disease, and all of those kinds of efforts that are statewide, mobilizing locals are fun and exciting for me.
Yeah, that's amazing. What are your future aspirations when it comes to public health?
That's such a big question.
It's a huge question.
My hope would be that more people understand the complexity of their health and the role that everything they do has on it, and that they would have a greater appreciation of the power of the collective good to support their health. So when people around me are eating healthfully, it's a lot easier for me to eat healthfully. When people around me are always like, let's go for a walk, I move more. When people around me are getting the adequate sleep and no one's bragging about how sleep deprived they are, then we all improve our health, and collectively we need our partners to help us, like our friends, our family, everyone around us, creating the collective good that improves everyone's health.
I completely agree with that, 100%. What would you say is the best part of your job?
So I just changed jobs, and the best part of my job is when I get to talk with people like you. I love working with students. I just joined the faculty at Public Health Sciences, so I'm working with students again. But I also love working with any training situation. So for example, I mentioned the local public health leadership series. I love working with local leaders who are motivated and championing change in their organizations and just creating conditions that help support their practice.
I love that. That's amazing. The next question I have for you is, what challenges would you say you've come across so far?
I think the biggest challenge that I experience in public health at a community level is the challenge between the value of the individual and the value of the community or the public good. So for example, once upon a time I got to work on clean indoor air legislation, and individuals have rights to smoke, but do they have a right to smoke everywhere? Does the collective good value improved health by not allowing people to do some behaviors? And so it's frustrating and troubling to me that there are many who think that the public good isn't even a thing, or that they value the individual so much more than the public good, because collectively we can create conditions that improve everyone's health. But sometimes that means that people don't get to have trans fats or other things that will harm their health. And so I think that tension between policy to improve health is one of the biggest challenges. And I believe in the collective power of policy. It's why most kids go to school immunized, and why most people have fluoride in their water to improve their health. So policy is important, but it requires us to work collectively rather than individually.
Exactly. I agree with that as well. And then the last question I have for you today is, If you had to pick one topic to shed more light on or fix within public health, what would it be?
So it's really hard for me to come up with just one thing, but I think that I would like more people to appreciate the complexity of their health and to recognize that the social determinants of health influence everything. So education, housing, safety, equity are critical components to improving the health of each individual and the community as a whole.
I completely agree. Thank you so much for sitting down with me.
You bet. Thanks.